Yes, my name is Eric Wilburn. I'm in the doctoral program in ISDT, Instructional Systems Design and Technology. This is ISDT ID presentation for Dr. Kimberly LaPrairie. So we were to choose a scenario to present and develop our industrial design product, technological product for give to these people. I chose the healthcare option because I have familiarity, background experience, and work history in that field. So we were given 7 questions that we were to address regarding the ISDT rubric. Question number 1, we'll get to that in just a moment. The scenario that I chose involved a director of a healthcare staff that needed a particular CD-ROM instructional product remedied. There were problems with the CD-ROM, the instructional product that they had on hand. It was changing information, patient's information, not accurately reporting information, altering information. The distribution and of the information was affected. It was apparently a bad product as believed by the director of the healthcare personnel. My responsibility was to assess the situation, to develop replace it with an effective instructional product, and for my team to reduce the cost as well as limit the amount of clinical training time that the staff would have to endure. Question number 1 says, what is my specific role as I perceive it in this situation? I kind of just answered that. I've been chosen or contracted or whatever have you to evaluate, assess, and deliver an instructional product that would effectively remedy the current malfunction situation malfunction with the CD-ROM product on hand. So then there again in my mission statement, to develop a custom training program for the healthcare staff to accurately account, maintain, and defend patient information, medication trail, lab diagnostic, x-ray, and other test results in their respective chart. This training program will require reduced training. That was one of the stipulations as I understood it in the scenario. Going to question number 2, it asks, what design considerations must be taken into account when addressing the identified need? My response to that is to make the instructional product designed so that it in turn reduces clinical training time. We'd already gone over that. Make the instructional product cost effective. We'd already touched on that as well. Number 3, the instructional product needs to comply with standards. So standards, you have OSHA, you have HIPAA. HIPAA is a very interesting standard in the healthcare industry. In HIPAA, and you can Google this and research more about HIPAA, but HIPAA is a standard that ensures patient confidentiality and the illegal breachment thereof. So a lot of that, there's a lot in the HIPAA standard that applies to patient information. And that's a whole nother soap opera there. You'd have to research that and get into that. I can't accurately describe that in 15 minutes. So that being said, number 4, accurately documents, maintains, and defends. So we need to accurately document, maintain, and defend the patient's information so that it does not get altered, changed, or come up missing or whatnot, whatever the problem would be. So that's question number 2. Question number 3, what questions would I ask to assist myself in determining societal and learner cultural factors? Okay, so you're getting into these factors a little bit kind of different here. Number 1, I would ask what instruction should the healthcare worker receive based on their cultural and learning skills. So everybody learns different. You have fast, slow learners, some that are not going to conform to the application of this product as well as others. So you have those, you have their cultural backgrounds. Everybody has different ethnicities, societal, cultural backgrounds, where they came from, how they grew up, what they perceive things as, and so those are all, you want to be everyone to be on the same page, and you want the user to have ease of use. Number two, what can result by not providing culturally safe services? Kind of just went over that. There'll be lots of problems when these users engage in the instructional product. What societal determinants exist? So you have people from all these different countries in the healthcare profession, the industry. You have people that have grown up differently. You have them from all different countries. They speak different language barriers. You have all kinds of societal and cultural differences with people that need to be addressed before you put this product out. So who will be the users? So they're there again, they're your customer. The users are going to be using this product and everyone needs to be on the same page. All their cultural and societal factors must be addressed. Number three, cultural awareness and cultural competency are required for cultural safety. I like that quote right there. That came right from an article that I had presented from my research by Mr. Latif in 2020. And my references will be located at the end of this presentation. Question number four, what are the contextual and designer-related constraints that may present themselves in this process? My answer to that, some of the most significant factors affecting performance, development of instruction, and the application of educational technology in healthcare are knowledge and research, costs and managed care, regulations and standards. We already went over the cost, and the regulations and standards touched on a couple of those. And convergence. We already touched on convergence, as well as the external factors influencing the production and development of the instructional product. Technology is always changing. You have to keep up with it. There are many factors that are involved in convergence. That's straight out of the textbook in Reiser and Dempsey in 2018. I have a pie graph that kind of gives an example of the main challenges as an instructional designer when you're developing the product. Question number 5 asks, as the designer, how would I attempt to prevent or overcome the constraints that I have identified in the scenario? So my response to that is, number 1, reduce the cost. That I did a little research from an article, Bell, Morton, and Severance in 2018 kind of goes over some constraints and cost-related issues when developing the instructional product for the healthcare industry. Number 2, reduce clinical training time. That was a prerequisite of the healthcare director, so definitely need to address that. Number 3, identify regulations and standards. Went over that. We went over HIPAA briefly and OSHA, etc. So you definitely want to stay within the aforementioned healthcare standards in the industry. Number 4, identify convergence. So you've got a lot of convergence issues with this. You have in the healthcare industry, technology is always changing. There's different machinery being implemented, different equipment. The assessment of the patients are varying from the equipment's always changing, so you have to keep up with it. The instructional product needs to be in compliance with whatever equipment's being utilized. So that is a convergence constraint there. There's many examples of that. You have lots of things that are in convergence, can be inclusive, that are inclusive in convergence. Question number 6, which type of instructional design development process or model would be most applicable in the scenario. Getting into this, our development team chose the ADDIE model. We're going to get to the ADDIE model in just a moment, but we chose a cloud related product to assess the needs of the healthcare director in this scenario. We felt that product would be most effective in maintaining, defending, and accurately reporting the patient information, tests, etc. It would be stored information. The information would be accessible within OSHA or the HIPAA standard guidelines, the other standard guidelines, and we felt that would be the best product to use in harmony with our instructional product. So our instructional product will involve a cloud. Clouds are becoming more and more popular as time goes on. So the evaluation and of the quality and effectiveness of both the instructional product and learning applications. So went over this in the cloud and other applications and effectiveness evaluation in research journal article that I had presented, Bardswell, Lee, and Zhang, 2014. Question number 7, which technology integration model would I select to guide instructional design in this scenario? And so we just touched on that. It was the ADDIE model. Our development team used the ADDIE model, which is analyze, design, develop, implement, and evaluate of instructional design to manage the instructional product and training process. This process included user profiling, very important. This goes back to the societal and cultural constraints. The formulation of teaching and learning objectives. You got slow, fast learners. You got all kinds of different learners. Constructing a blueprint or targeted instructional assignments. Designing an aesthetically sound interface. Effective interaction design. Very important. The product must be user-friendly. The users must use the product with ease, use it effectively, and be very easy for them to use. Very important when designing a product. Any product, actually. So, that being said, using various multimedia development tools and appropriate programming languages. These are all constraints when you're developing an instructional product. And that's right out of Bardswell, Lee, and Zhang, 2014. So here are my references. I had 4 references, including the textbook. Very, interesting articles to read and research. They were very helpful in making my assessment of the development of this instructional product for this particular scenario. Thank you for your time.